A 65-year-old male presents with progressive gait imbalance, clumsiness in both hands, and difficulty buttoning his shirt for the past 10 months. MRI reveals multi-level cervical stenosis from C3 to C6, with significant dorsal compression of the spinal cord, but he has a neutral cervical sagittal alignment. What is the most appropriate surgical approach for this patient? How to think about the answer. Think about the keywords in the question. 1. Progressive gait imbalance. 2nd, clumsiness in the hands. 3rd, neutral sagittal alignment. Choices. A. Anterior cervical discectomy and fusion, ACDF, from C3 to C6. B. Posterior cervical laminoplasty, from C3 to C6. C. Anterior cervical corpectomy from C4 to C5 with fusion. D. Posterior cervical laminectomy and fusion from C3 to C6. E. Observation and physical therapy. Correct answer, B. Posterior cervical laminoplasty from C3 to C6. Explanation. This patient has cervical myelopathy due to multi-level cervical stenosis, C3 to C6, with dorsal compression. Given his neutral cervical alignment, the best approach is posterior cervical laminoplasty, which preserves motion while adequately decompressing the spinal cord. Laminoplasty is preferred over laminectomy and fusion in neutral lordotic spines, because it avoids long-term complications such as adjacent segment disease and loss of motion. The posterior approach is preferred over the anterior approach for multi-level cervical stenosis with dorsal cord compression. Why other choices are incorrect? Anterior cervical discectomy and fusion, ACDF, from C3 to C6. Incorrect, because ACDF is not ideal for multi-level stenosis. ACDF is best for 1 to 2 levels of disc-related compression, not extensive dorsal pathology. It would require multiple level fusions, leading to increased complication risks. Anterior cervical corpectomy from C4 to C5 with fusion. Incorrect, because corpectomy is reserved for ventral compression, not dorsal stenosis. Higher morbidity and pseudarthrosis risk than posterior approaches. Posterior cervical laminectomy and fusion from C3 to C6. Incorrect, because fusion is unnecessary in a neutral alignment spine. Fusion should be considered only if the patient has cervical kyphosis or instability. Laminectomy alone risks post-laminectomy kyphosis in patients without preoperative lordosis. Observation and physical therapy. Incorrect, because the patient has progressive myelopathy. Cervical myelopathy is a surgical condition. Delaying treatment increases the risk of irreversible neurological decline. Find more questions at orthomcqhub.com. Success in orthopedic exams starts with the right preparation. orthomcqhub.com provides expertly crafted MCQs that closely resemble real exam questions, ensuring you're fully prepared for the FRCS Trauma and Orthopaedics Part A and EBOT Part A exams. With a proven 95% success rate among past candidates, our question bank is your ultimate tool for mastering key concepts and refining your exam technique. Don't leave your future to chance. Start practicing today and take the next step toward orthopedic excellence. orthomcqhub.com, your key to success.